Asian eyelid surgery post-operative healing after 6 months, 1 year, 2 years. Any suggestions? Typically, how much does the eyelid fall after 6 months, 1 year, and 2 years of healing after Asian blepharoplasty is done? Will it be the size of the crease that the incision was originally supposed to be made? For example, if the patient decided on a 7 mm crease, will the final crease after all swelling is gone be 7 millimeters? Or will the crease be dramatically lower? Thanks.
Thank you for your question. You're asking essentially about the healing process that occurs after Asian eyelid surgery, and you're focused on specific numbers in terms of level of the crease in millimeters, as well as different points of time along the healing process. And you want to know how low does the crease fall, as well as is it subtle or is it dramatic? Well, I can certainly give you some guidance on this question with the absence of a photo. I'm a board-certified cosmetic surgeon, a fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Asian eyelid surgery is a focused and specialty of mine in my practice, and this is the type of question that we deal with every day when we do consultations for Asian eyelid surgery. So, to get some understanding and perspective, we have to basically just understand a little bit of the basic anatomy that's relevant to an eyelid crease. First of all, in my practice and my style, if someone wants an eyelid crease, my goal is to try to create a crease in a way that looks as if nature had created it. It's well known that approximately 50% of Asians have a natural crease or double fold, and 50% do not and have something called a monolid. Well, when I evaluate a patient, I usually place some type of instrument in a way to kind of create a crease and see what would naturally occur if you were born with the crease. I feel like that is the aesthetic that the people who come to me prefer, and I feel that looks the most natural. So then we get into how do we create that crease? Well, there are two basic approaches to creating an eyelid crease, and it depends on the presence or absence of extra skin or extra fat. So we make a decision between a non-incisional versus an incisional Asian eyelid surgery. A non-incisional surgery means that I'm placing small openings in the skin, and what I'm doing is creating a connection between the skin and the muscle that lifts the eyelid called the levator muscle. If nature had created a crease, there would have been a natural connection there that is responsible for creating that type of fold. If someone needs skin removal, then we do an incisional Asian eyelid or Asian eyelid blepharoplasty. Skin is removed, and in some situation fat is removed. Now there are hybrid versions of these procedures where it's a partial incision and different ways to try to create a natural crease. Now the healing process, whether it's non-incisional or incisional, especially in the first few weeks, makes the eyelid crease look higher than it actually is. And that's because there is a certain amount of swelling that occurs between the eyelid crease and the margin or the eyelashes. And that makes the eyelid crease look like it's much higher than is intended. In general, I tell patients that swelling is still going to be present even if you look pretty good for several months, and technically it can last up to a year. Now, for most people, 6 months is when the majority of swelling has resolved, and you can essentially feel like that area, that level of appearance is stable. Now, to address the question about a 7 mm versus 6 mm versus an 8 mm, the way I figured this out, typically, if we want to make it a natural crease, there is an element or a part of the eyelid called the tarsus. And that is usually the height of the tarsus, which is kind of the backbone of the eyelid, is what usually determines where a natural crease would have fallen. Now, the height of that crease is relevant, but it's only relevant up to the point where the skin is anchored to allow for a certain amount of folding over of the skin to create a natural look. When we do this type of surgery on a non-Asian patient, well, it's a very different story. We're trying to actually often excise skin or remove skin more aggressively to create a larger eyelid platform, basically the place where you would put eyeshadow. However, when it's dealing with Asian eyelid surgery, it's the amount of lid that shows that is customized. And so the anchor point is typically higher, but, or I should say at the height of the tarsus, but the amount of skin that is allowed to fold over is what we try to aim for in terms of how much skin to remove if skin removal is intended, or the amount of skin that is folding over if it's a non-incisional. Now, there's always a natural equilibrium that occurs, and technically that crease can be somewhat mobile, so that if you aim for, let's say, a 7 millimeter crease, as in your question, and you actually measure it when you are done with the healing, on tension, the skin can have a certain height, and without tension, the crease can have a different height. In the end, I think it's not necessarily helpful for you to stay focused on the height of the crease, but rather on what is your ultimate desired result. And so whether you want a particular elevated position of the crease to be exactly where you place it, that is actually more of a technical issue for the surgeon to try to ensure that the final cosmetic outcome is desirable. So I recommend you meet with doctors who have a lot of experience with Asian eyelid surgery and discuss this question and concern. A lot of times people get very focused on these numbers, but the human body is much more elastic, and there's always a balance of factors that ultimately result in a good cosmetic result. So learn about your options, see which type of procedure would be best for you, and review some before and after pictures with your prospective surgeon, and look at the different stages of healing, and I think you'll get a much better sense than asking kind of in the theoretical. So I hope that was helpful. I wish you the best of luck, and thank you for your question.